Welcome back. It is now 8:10. When should most women start having mammograms? Last year, a blue ribbon panel recommended they start at the age of 50, but now a new study of 1 million patients suggests that women in their 40s who have mammograms can significantly cut their risk of dying of breast cancer. Our Dr. Jennifer Ashton is here to tell us more. Good morning, Jen.
Good morning, Maggie.
So what did this study find?
So you remember last week we talked about a study out of Norway. This study came out of Sweden. It was a very large study, over 1 million women. Did have its limitations like every study. However, it found that women in the 40 to 49-year-old age group who had mammograms reduced their risk of dying of breast cancer by 26%. Again, I do not think this is a game changer. This is just another in the battle, ongoing debate between mammograms, pros and cons.
But it is in keeping with what we had heard for much of the time, that women in their 40s should have mammograms. And then last year, this preventive task force changed it to 50. Why did they change it to begin with?
Well, a lot of it has to do with science, that mammography is not a perfect screening test, Maggie. It has a lot of limitations involved. It has false positives. In other words, it can find things on mammogram that turn out not to be cancer. It has false negatives, meaning it can give you a normal result and there can still be a cancer there. Obviously, there's cost involved. It's not a perfect test, but right now, it really is the best imaging/screening test that we have. And last year, the reason that the Preventive Service Task Force said it might not be so great or even recommended in women in their 40s really comes down to numbers. It comes down to statistics. And this study actually was in keeping with that. It showed that, in order to save one life, over 1,200 mammograms would need to be done every other year for a 10-year period for women in their 40s. Now, the hardcore statisticians and scientists will say, well, those numbers do not support its use in this age group.
Except if you're the one life.
Exactly. But for women who are that one life, or for doctors like myself who sit across from a patient and say, you might be the one, or I don't want to miss the one cancer in you, my one patient. Emotion comes into play, and medicine is a science, but it's also an art. So you have to take into account science, statistics, numbers. You also have to take into account emotion. There's no getting around it.
A lot of women probably didn't do it because it was expensive, but now with this new health insurance coverage plan that's going to be covered, so I bet we will see more women do it. Is that what you would recommend to your patients? Do it just in case?
Well, in medicine, again, in science, we don't want to do things just in case. We really do want to go back on evidence and do risks and benefits balance each other out, and are the pros and the cons in keeping with whatever we're recommending. For low-income women, though, Maggie, mammography is still not as accessible as we would like. So that is a target population that, yes, we hope with the new health care reforms, those women will have mammography or other screening tests available to them. And I can tell you that with anything that changes this quickly, most doctors and most women will stay the course for now and not make any sweeping changes.
Dr. Jennifer Ashton, thank you, Jen.